All right, and Nina, would you like to begin?
Sure. I will go right ahead and do that. So, ladies first. I'm not going to read this whole slide. It's a little dense. But ladies first has been around for a long time, for 25 years, and it's a national program. It was created by an act of Congress, literally an act of Congress. The Breast and Cervical Cancer Mortality Prevention Act established the program, and states were given the option of buying in, and all states have done that, as well as the District of Columbia and American Indian and Alaska Native tribes and territorial organizations and territories. So it's widespread. So that's the breast and cervical cancer screening portion of the program. We also, more recently, but I think maybe 10 years ago or more, applied for another grant, which is related to cardiovascular screening, and that is called WISE Woman. It's a clever acronym, Well Integrated Screening and Evaluation for Women Across the Nation. And there are about 21 states that have that grant. So when you have that, if you have this WISE Woman grant, it's folded under Ladies First. It's not marketed separately. So we don't really, we don't talk a lot. We don't market it separately. We market that we do cardiovascular screening, but we don't market the WISE Woman program per se, because all of the eligibility is the same and the program processes are the same. You sign up for Ladies First, you get the breast and cervical screening portion, and you get the heart health screening portion automatically. So we try to keep it simple for especially for the public. We want to keep it very simple and clear. So what are the services provided by the program? We are an early detection and screening program for breast cancer, cervical cancer, and cardiovascular disease. Because we are a screening and early detection program, what we pay for is screening, and not for treatment per se, but we pay for breast cancer screening, which would be mammogram, and any kind of diagnostics that are needed. So we do pay after, we'll get into this a little bit more, but after an initial screening, we do pay for diagnostic follow-ups if needed. We pay for cervical cancer screening, which is, of course, the Pap test, the pelvic exam and Pap test. And we pay for cardiovascular risk factor screening. So we're screening for the key risk factors for heart disease. So that is height and weight, to assess for BMI, overweight issues, blood pressure, and cholesterol and blood glucose testing. So those are the risk factors that we screen for. Recently, we've added a really exciting component to our program, which is called, we call it the lifestyle programs. I think sometimes to the general public that maybe doesn't mean a lot, but when we say things like Weight Watchers and curves, that means a lot. So we have these programs now that involve health coaching, setting up health-related goals, and actually, if a woman is interested and has a risk factor, she can get into programs like Weight Watchers or curves, and classes at the Y, specific classes that we've arranged. So these programs, a woman works with our dietitian. We have a dietitian on staff who helps women and guides them through these kind of programs, and they're available to a woman after she's had that screening. So a lot of women this is catching people's eyes, and a lot of people are calling about it. They do have to have the cardiovascular screening first. So then we also, as it says on the screen, we pay for follow-up tests and diagnostics needed after mammogram or Pap test. So frequently it's the case after a mammogram that a woman gets called back for a second mammogram, sometimes for an ultrasound, a biopsy, etc. We pay for those things. So we pay for anything up to and including diagnosis. If a woman is unfortunately diagnosed with breast cancer, we are not able to pay for treatment. However, we are able to get women into, if they don't have any insurance, we're able to get them into the breast and cervical cancer treatment program. So we are like the gatekeepers for that program. So if a woman has a diagnosis of breast or cervical cancer, this is not involving heart disease, breast or cervical cancer, and she has no insurance, because as we'll see later on, a woman can have insurance and be in Ladies First. But if she doesn't have any, then we can get her into this program, which is a type of Medicaid, actually, and it's complete insurance. So it will pay for not only for her cancer treatment, but it will pay for everything, any kind of medical situation that she has. I had a woman on the phone actually say to me, this is true, now I can get that colonoscopy that the doctors have been after me to get, because you get full insurance And that program, women can have insurance for up to 5 years, as long as they're considered to be still be in treatment for their cancer, which with breast cancer, often some of the hormonal therapies will go as long as 5 years, so you can actually stay in the program a long time. But we're the gatekeeper. They have to work with us to get into that program, and it's also administered, actually not by us, it's administered by the Medicaid folks. So what is included in a typical Ladies First office visit? So it includes a clinical breast exam. It includes well, actually not self-exam so much anymore. Breast self-exam is kind of gone the wayside, and what they're promoting now is breast awareness. And I won't get into the reasons why, but there's just a little bit of issues about breast self-exam versus encouraging women to be really aware of what their breasts are like normally, and then be alert to any kind of changes that might happen. Mammogram referral, because obviously it's not getting done in the office visit, but if a woman needs a mammogram, referring her onto that and helping her figure out how to do that. Pelvic exam and Pap test. We also now will pay for HPV testing, since that's become such a critical component of figuring out a woman's risk for cervical cancer. So we do pay for that as well. Blood pressure. The CDC would like us to have 2 blood pressures done, so we know that that's not always practical in an office, or it's not always doesn't always fit in with the office procedure, but that's our ideal. We do get dinged, actually. It's a grant program. We do get a little dinged if we don't have 2 blood pressures on record for someone, so we would really hope and encourage that you might be able to work that in for Ladies First members. We also pay for total cholesterol and blood sugar testing, body mass index, of course, just to assess women's risk of overweight and where she's at with that. And risk reduction counseling, we can now pay for. And we also, again, what I mentioned a little earlier was these lifestyle programs. So the office visit would include sort of alerting someone to the fact that they're eligible for this. And we take it from there. Once she's had her cardiovascular screening, we can tap her into all kinds of resources in her community, and including 802 quits, which I didn't mention previously, nutrition counseling, setting up health goals, getting into one of these programs, or if a woman's not ready for that, kind of working on what she needs to do to get ready for that. So healthcare providers and staff are essential partners to us. You are just key to us. You're our main source of referrals, for one thing, by far, actually. And the ways that you can help us make this program work are by identifying existing and potential members. So let me talk about that for a minute. If a woman is already a Ladies First member, we really encourage her to bring in her member card. It's not a card it's not laminated. It doesn't look like a credit card. It doesn't even look like most insurance cards. We're going to be changing it soon, but right now it's really just a thin piece of paper that she's cut out from a brochure. But it does have on it her name, an identification number, and some dates. And that is her, well, I was going to say, who she's a member. You may not know for sure that she's a member just by looking at that, because if she's gone on to Medicaid, she would have gone on to Medicaid and be bumped off of Ladies First. But what that card will let you do, it'll give you the ID number, and you can look her up in the electronic verification system. So Ladies First will appear in the electronic verification system if she's on Ladies First. So then you can see that if she has a Ladies First card, she should either show up as being on Ladies First, or if somehow she's gone on to Medicaid, it'll show Medicaid and that the Ladies First ended and the Medicaid started. So you can go into the EVS and look for that. Potential Ladies First members is a little different thing. But that would be women who, now we do get a lot of referrals from healthcare providers for women who don't have any insurance, because I think that your eyes are a little, alert to that. Like, oh, a woman doesn't have insurance, let's figure out what we can do. Actually, though, women can have insurance, and we'll get to that slide, but you can actually have insurance as long as it's not Medicaid or Medicare Part B. Some women have Medicare Part A only, not a very smart choice, but they do, and we can work with them. But if a woman has Medicaid or Medicare Part B, we cannot work with them. But other women who have insurance, including insurance through the Health Connect, even if they're being subsidized through Health Connect, if they meet our other guidelines, which mostly is going to be about income, then they can be in Ladies First. And there are some advantages to that, which I'll talk about in just a couple minutes. So the way you would identify a potential Ladies First member is mostly going to be by income. And this would be particularly if you're in a community health center setting, you may have that income information. If someone's on your sliding scale, that's a good indication. So our income limit is 250% of poverty, which I will show a chart, but you may have your own charts if you do a sliding scale. And so that would be a clue if a woman's on your sliding scale. But essentially, if a woman is 250% or less of poverty, then they are a potential Ladies First member, and you can certainly call us to find out if they qualify. So other ways that you help the program work are helping women understand how the program might benefit them, particularly, especially for women who have insurance. One of the really big pluses is that those lifestyle programs. So they can be eligible for those lifestyle programs. So if you have a woman who has risk factors, or maybe you think she really, could really benefit from Weight Watchers, then it might really prompt you to look and see, oh, is she eligible for Ladies First, so we can get her into that. You make the program work by understanding our guidelines, and which is part of why we do educational events like this. Also, providing us with results after screenings. So we are not insurance. We are a public health program, and so we need to have results after that, after a woman's been screened. In fact, the CDC really doesn't count that woman's screening as a screening if we don't have the results. So even if we've paid the bill, it doesn't count. So that's why we need one of the reasons we need the results. The other reason that we need results is because we have a quality assurance component to our program. So again, because it's a public health program and not an insurance program, we have an obligation. We have a grant obligation as well as just our own ethical obligation to assure that if we're screening a woman and she needs some kind of follow-up screening or treatment, we have an obligation to help make sure that that happens. So that's the last bullet, which is informing us of abnormal results. If a woman has abnormal results, we really want to help, and we can be an extension of you, and we have a little more time probably than you do, because we have a little more personal attention in terms of our numbers aren't as overwhelming. We can really outreach to that woman and make sure that she's going to come back to that next appointment. So we would talk with you, figure out what the plan of care is. Is she supposed to come back for a colposcopy in 3 weeks? I would talk with her about, and you probably do some of this as well, but I'd really reinforce with her that she needs to do that. If anything comes up and she can't do it, she needs to call us. If she needs transportation, we can provide transportation. Things like that. So we're able to be extenders of the practice in terms of getting those women back in to service. So call us anytime you have any questions at all about any of this. So who is eligible? It's actually pretty easy. It really is. It's much simpler than most other kinds of programs. So they have to live in Vermont. That's pretty easy to determine. They have to be 21 years old or up. The reason for that being that at this point in time, routine screening through a Pap test doesn't start until age 21. We know that some women do get them at a younger age, and as it says on the screen in the bullet, we can cover younger, high-risk women in special circumstances. So occasionally, someone will get a Pap test who's younger than 21. It will show up as abnormal, and we can get the woman into the program at that time if she needs us. So please call in that situation. The income is usually the big key here. 250% of poverty level based on household size, and there's a chart on the next slide. Insurance status, so she can be uninsured or she can have private health insurance, including insurance through Vermont Health Connect. So a lot of people don't realize that. And really, when I get a referral from a doctor's office, 99.9% of the time, a woman has no insurance, which kind of leads me to think that maybe providers don't, that we haven't gotten the message out to providers as well as we might. So we really want to get that message out. The woman does need to be a U.S. resident or a qualified alien. The income limits, it's right off, based off the federal poverty level, pretty straightforward. But you can see also that pretty generous in some regard. So particularly if you're talking about a single parent with a couple of kids, this could be a person who's working and has a pretty good job, right? And they could still be eligible. So don't think of this, it's obviously, folks that are eligible for Medicaid are covered by that, but this is really catching a whole other group of people.
We'll talk to them and assess their income. If
Oh, yes, Nancy's reminding me of something very important, which is that we don't have to look at just the last year. We don't have to look at what was your tax return for last year or what was your income over the last 12 months. We can really look at what is your income now. We maybe say over the past 30 days, past 60 days. We're not going to say, what was your income this week necessarily, but we can be very flexible in terms of if someone has lost a job or if one of the people in the household has lost a job, we don't have to look at what their last year's income was, okay? We don't even have to really project what this year's income is going to be. Maybe they're going to get another job. We hope they will. If they're on unemployment right now, we can get them on the program right now. Even if they're going to, even if we anticipate maybe they're going to be getting a job, we can get them into the program. So we do look at the income right now. We can look at monthly as well as that annual. And this does come up a fair amount. People, and also we look at things like self-employment, income, seasonal. You had a really good year last year. We do have a lot of people in our program actually who are self-employed, and their income, may fluctuate a bit. Self-employed people are definitely a group of people that has trouble finding good insurance. They may have a really high deductible plan, and their income may vary. We'll really try to work with them to get them in the program. It's a very easy process. A woman calls to see if she's eligible. She doesn't have to call, but that's typically what happens because then she doesn't have to fill out an application if she's not eligible. So typically she will call to see if she's eligible. We'll send her an application. She can get the application in the provider's office. You can work with her in whatever way works for your practice. If you have a navigator in your office that can work with the person, great. If you have a care coordinator who works with people on these issues, that's great. However your office is, you might just want to think about what you want your system to be. But she can get the application in your office. You can try calling. Actually, you or the woman can call right then and there. We're not always there. I mean, right now I'm doing this, so I'm not at the phone. I am at the phone a lot of the time. I would say roughly at least 50% of the time I am sitting at my desk to pick up the phone. So, often you will catch someone, and we do also return calls really promptly, but that, the person may have left your office. But please give us a call to see if we are available. We will help you. We can call the woman back promptly. We can call you back promptly. So it's a pretty easy process. If she's eligible, she fills out an application. She returns it to us, or that can be faxed from you. You can, you can't really make a determination per se, but you can be pretty sure based on those guidelines if someone's eligible or not. I mean, if it's pretty clear cut, just have her fill the application out right then and there, send it off to us. We process it. It takes us somewhere between 10 days to 2 weeks usually to get a card out to her. We don't run them every day. So then we process the application. She receives a pamphlet in the mail that has a card integrated into it that she has to cut out. She also gets, when she gets that member card, she gets a provider report sent to her. The provider report is what we can receive the results on of the visit. So the provider report has a space for all the different things that we provide. So it also works as a nice guide for you that you can look at the provider report. If something's not on there, we don't pay for it. If it is on there, we do pay for it. So it's a handy tool. We don't have to have the results on there. Office notes and pathology reports work for us just fine. But that's what the provider report is about. And the application and the provider report and all of our forms are actually available on our website, which the web address is at the last slide of the show here. So I'll put that up for you. The way it works in a really linear way, if the most linear way is that she gets the application, she gets the member card, then she calls and schedules her appointment. If she doesn't have a provider, we will help her find one in her area. But it doesn't often work in the real world quite that linearly. So sometimes you might have someone in your office and you've actually already done the services, or you'd like to do those services, and you identify that she's eligible, and that's fine. You can give her that pelvic exam and pap test that day, because our membership is 90 days retroactive from the date she signs the application. So if you're pretty sure someone's eligible, you can go ahead and give that service, and then then we will do the paperwork. Will catch up with her at some point and with you, and you can bill us. So I will sometimes tell people, this comes up a fair amount. It also comes up when women have abnormal mammograms and they need to get a repeat or a diagnostic. And maybe they were not a Ladies First member till now because their insurance pays for a mammogram, but it's not going to pay for the diagnostics, okay? So then they sign up for Ladies First and they say, oh, well, I'll postpone my appointment. And they don't need to postpone their appointment. They go to their appointment as soon as they can, and we'll get the paperwork done to catch up, okay? There's our 800 number. So how does it work when a Ladies First member has insurance? If she has insurance, her insurance will be billed first. We are the payer of last resort. So here's how this works. If she's got insurance, most insurance now covers preventive screenings, right? So her mammogram is going to be paid for, her pap test is going to be paid for. Why bother with Ladies First, right? Well, here's a couple reasons why. One reason is if she needs any follow-up tests, and this happens a lot with mammograms, and it happens a fair amount with pap tests too, and if she's not met her deductible, her insurance isn't going to pay, but we can pay. Okay, so that's one really big plus. The amount will be applied toward her deductible, but it has to be submitted to the insurance first. They're going to kick it back. They're going to say she has not met her deductible. It's going to get billed to us. We're going to pay for it. If she has met her deductible, we'll usually pay the balance of whatever. If she's met her deductible, the insurance will pay something, and we'll usually be able to pay the balance. So there's a few situations where that might not be able to happen. And the reason for all this is that insurance companies currently do not view these follow-up tests as part of a screening, which seems a little odd in a way, but they don't seem to right yet. They're going to. It's actually in process that they're probably going to be considering like a mammogram callback as part of the screening. Right now, they consider it, a symptom and not part of a screening. But before I leave this slide, though, for women who do or don't have insurance, the other reason, of course, mostly for women who do have insurance, another reason to get her into Ladies First would be because of those lifestyle programs, because that is not provided by her insurance. So after the visit, the woman receives her results usually from you, and we need to receive the results as well. And if follow-up treatment is needed, we will help her identify it. As I mentioned before, we'll kind of help you and work in tandem with you as an extender of the office staff to help her get to that appointment and make sure that it happens. Women who don't have insurance are often concerned, understandably, about the cost, and so we can really help reassure them with that. After the screening, if she's had her cardiovascular screening, which we hope she's had, had everything, we will get in touch with her about the lifestyle program. And then membership is good for 1 year, unless a woman goes on to Medicaid or Medicare in that year period, because that will really bounce her off without us even doing it. It's sort of the system.
She's on a lifestyle program, in which case.
Okay, so Nancy's reminding me that if she is not on a lifestyle program, when she goes on to, say she's joined Ladies First, she's gone on to a lifestyle program, 6 months later she goes on to Medicaid, she can stay on the lifestyle program, even though she's on Medicaid. So that's a good thing to know. But at any rate, she will get an annual renewal. We send those out to people once a year. Some common challenges with PowerPoints is that your stuff doesn't always show up. I'm not sure why this has not showed up. Oh, okay, here we go. It was set up like this. I didn't know that. So Ladies First members are not always identified as such, and potentially eligible women who are not always identified. The member might receive services that are, okay, this is a good one. The member might receive services which are beyond what we cover. And I know it can be tricky because sometimes the doctor doesn't actually know that the woman's got Ladies First. And so this can be a little tricky. But one of the common things that comes up is, well, the doctor wants to order additional blood work. Particularly, because we're working with a lot of middle-aged women, often the doctor will want to get a thyroid level. We don't pay for it. So, or they want to get a little more blood work, a CBC, something like that. So that the woman can end up with a lab bill. I mean, the visit's been paid for, and the drawing maybe has been paid for, but she's going to end up with a bit of a bill. So it's really something to try to be aware of and talk with the woman about ahead of time so she'll know. And we may pay for a service but not get the results from you, and that's just a challenge for us because we have to sort of chase it down. We're not always notified in a timely manner when a woman has an abnormal screening. And again, we know, whoops, I'll go back. So again, we know that our program is a little different from insurance, and if you don't use use our program a lot, some of these things are hard to remember. We do understand that. So if you want to get in touch with us, so we have a member services line, which is an 800 number. I'm the member services coordinator person, so any questions about eligibility, is a woman a member or not, does, is she eligible, how does she get in, what is covered, that kind of thing, you would call me. We have someone who's devoted to billing issues. So when there are really tricky billing issues, if you've billed and it's been denied, then it would usually be a call to our billing specialist, Carrie Frenier. And our dietitian, Siobhan Donegan, is the person who knows all about the lifestyle programs, and she's the person who gets in touch with women after they've had their cardiovascular screening. And then Nicole Lucas is our director, and Nancy Kaplan, who's here with me, is our program manager. So I've been talking for a while. Does anyone have any questions?
I actually do.
Okay, sure.
Because I'm so new to my job, would it be okay if you guys could send me a copy of your PowerPoint just so I have it to reference to? Because it was pretty informative.
Sure.
And I could find it in my office.
Yeah, that's fine. Kristen, you say Kristen? Yeah, Kristen, you want to make that available? Okay.
Yep, I can send it. It's this exact same one that you sent me earlier, right?
Yes.
Yep, so I can send that out.
Did we make any changes? It's good enough. We'll send it out. We'll give it to you, yeah. And maybe,
Yeah, whatever you guys have, just so I can stay up to date.
Sure, and and we have a website as well. Oops, I thought the website was on here. Yes, it is. Okay, so ladiesfirstproviders.vermont.gov is a website specifically for providers.
Okay.
We have one. We also have one for the public. We have two different websites with different emphasis. But the one for providers has all of our processes, all of our forms, all of our contact information, more than you ever wanted to know about Ladies First. Actually, no, there's a lot of information on there, and you can print out the forms and so forth.
Okay, thank you.
And call anytime too, Candace. Just anytime.
Definitely. Thank you very much.
I did think of one other thing, and then I'll take some more questions too if there are any. But I did want to just briefly mention co-pays. So Kristen asked me earlier, well, what about co-pays? And the co-pay issue can be a little bit tricky. But here's the thing: co-pays shouldn't ever really enter into the situation, because the kind of services that we pay for are services. If a woman has insurance, for example, there's almost no policies out there anymore that are going to charge her a copay for a preventive health visit. She's going for her annual PAP, her mammogram, any of those things, those are free with no copay. If she's going for a diagnostic service, that's not a copay either. That's a co-insurance where she has to pay a certain percentage of the bill. So there really are no services that we provide that are going to involve a flat copay, like your $20 copay kind of thing. If you had a situation like that where a woman's got a really old policy and it's going to pay for her visit except for this, $10, $20 copay, give us a call and we'll work something out. I mean, the intent of our program is that a woman doesn't have to pay for these services, and there's just very few of those situations out there. Are there any other questions? Kristen, did I miss anything? Nancy?
I think you're good.
Sorry, I had to unmute myself there. Not that I see. I think you did a pretty good job covering it. You touched on the points that I want to make sure that we address. So thank you.
Sure. So again, call anytime. We're in the fortunate position that we are able to answer the phone, and we don't send people off to, people. It's not really hard to get a hold of us, and women often will say that. Boy, you're really not that hard to get a hold of. So it's not like a lot of bigger programs where, they go into voicemail and then it gets to, to another voicemail and then they never hear back from anybody. If they get my voicemail, that's all they're getting. They're going to dial that 800 number. They're not gonna get a choice, press this, press that, nothing like that. They're gonna get me, I'm gonna call them back within 24 hours, generally speaking, unless it's a holiday.
And I want to just say too that, Ladies First does a really good job trying to include as many women as they can. So if you're ever not really sure if a woman might be eligible, it's always a good idea to try to, to talk to Nina, talk to Nancy, try and get her in, because they really do a fantastic job trying to figure out a way to make women be able to participate in the program.
Yeah, and the one thing that sometimes comes up is, what constitutes a household? What constitutes income? This kind of thing. Household actually is anyone you're married to and any dependent children. So if you have roommates, they're not included. And for better or worse, that means if a woman just is living with a man, even if it's the father of her children, he doesn't have to be counted. So things like that, I could see how just looking at that chart, you might not know all that. And again, with income, we do try to be flexible. It does count all income, though, not just earned income. Sometimes people will say to me, well, I'm not working, I have no income, but they might have unemployment. I mean, they're still going to be eligible. They might have child support. We do have to count those kind of things. But again, we have a nice, we have some flexibility to really look at just this point in time. Anything else? Okay, we'll call anytime. Spread the word.
All right, thank you everyone for joining us today. And again, if you have any questions, let me know, or Nina or Nancy. They really are great at getting back to folks.
Thanks, Kristen. Thanks for hosting.
Thank you.
Bye-bye.
Bye.